this is our Congressman Sean Duffy. In his regular little buffalo plaid shirt. And I see you're wearing buffalo plaid too. Thank you so much. Yes. And I hope that this is a nonpartisan group so that Duffy can hear a wide range of opinions.
Representative Duffy, I wish that you would have spent the past 7 years improving the Affordable Care Act instead of wasting millions in taxpayer dollars. Trump Care will prevent me from retiring when I would like. I won't be able to. I'll probably have to work until I'm 65. The Affordable Care Act strengthens Medicare, and there should be a single payer option because health care is a right and should not be for profit. I've called your office multiple times, and I never feel like I'm heard.
Michelle, would you give your name?
Oh, my name's Michelle Hillstead, and I'm from Rice Lake, Wisconsin.
Thank you.
Hello, my name is Julian Bender, Glenwood City. And like I indicated before, I'm a total novice at this thing. This is the first time I've ever done anything like this. But as the song says, the times are a-changing. So I need to speak up. So what I'm interested in, Congressman Duffy, is what are your priorities? And I listed 5 that are important to me, and I think are 5 important things to Americans. So this is my prepared remarks. Dear Congressman Duffy, listed below are 5 issues that are important to me and are important to many Americans. I would like to know what your views are on them. Excuse me. On the assumption, like most Americans, that only you have so much time in your day and limited resources to accomplish what you want to do as a congressman, please rank the 5 issues from 1 to 5, with 1 being the most important and 5 being the least important. Please note that there's a personal rank and a political rank, meaning that you may have personal ideas about what's important, but the political process may readjust your priorities, and that's, I understand that. The 5 issues are climate change, gun control, immigration, women's health, and affordable health care. The first one, climate change. Here's my questions for you, or comments. What are your views on climate change? What are your views on what role, if any, is human activity playing in so-called climate change? Gun control. What are your views on the current control of guns? Do you believe that more could be done to keep guns out of the hands of persons who wish to harm us? Please explain. Immigration. What are your views on the current immigration laws and procedures? Are they adequate? Please explain. Women's health. When it comes to abortion, do you believe that pregnancy is a women's health issue that is best dealt with between the woman, her physician, and God? Please explain. What are your views on funding, federal funding of Planned Parenthood? Please explain. And lastly, affordable health care. What do you believe is the biggest challenge to implementing a better health care plan for all Americans? Please explain. Your responses will be greatly appreciated. And I'll also be sending you a letter via email. Thank you.
Thank you.
Sean, I'm Mary Heff from Rice Lake, and I opposed you in the most recent election. And we had an opportunity to listen to the same people talking in the 7th Congressional District. And what they said to me over and over and over again was, Mary, if you win, please help us keep our health insurance. But Mary, try to make it more affordable. You heard them, I heard them. I promised them that if elected, that's what I'd try to do. I don't know what your promise was. I hope your promise was the same. But right now, the American Health Care Act is anything but affordable. Under the Obamacare Act, 20 million people were added to health care, 20 million Americans. Now, under the American Health Care Act, they believe that as many as 15 million of those people are about to lose their insurance. That's not what I promised I'd do if I made it to Washington, and I hope that was what you would promise to make health care affordable. It's not under the American Health Care Act. What are you going to do for the people of the 7th Congressional District? Who's going to be hurt the most? You just heard Michelle talk. Michelle said that she's going to have to work longer. Who's going to be hurt the most? People between the ages of 60 and 64. People who are going to be losing their subsidies, but people who are going to be paying significantly more under this act. What are you going to do for those people? And you know, as well as I know, who the American Health Care Act helps the most. It helps the wealthiest 1% in our country, who are going to see amazing tax cuts because of this act. Those in the top 1% of 1% are going to see almost $200,000 every year in tax breaks. Come on, Sean. Let's help the people of the 7th Congressional District. Let's help the people of America get affordable health care, not health care that they have to abandon. Thank you. Don't abandon the people of our district.
Hi, my name is Tim Schultz from Rice Lake. I have kind of a rhetorical question here for Congressman Duffy, and it's a long one, so bear with me. Why does your party think that piecemealing a health plan together that chooses winners and losers and will increase rates, insurance rates due to adverse selection by allowing young and healthy people to opt out of the plan is better than providing an equitable plan of single-payer, universal care like the rest of the civilized world?
Congressman Duffy, I am sorry that you're not here to listen to these wonderful stories that you're going to be hearing before me and also after me today. I am Carol Ligler. I'm from Trigo, Wisconsin. I am one of your constituents. Today, I am a volunteer advocate for AARP. I would like to remind you again that there are over 830,000 AARP members in the state of Wisconsin, many of which reside in your district. To say that we are concerned about Social Security and Medicare is truly an understatement. The progress that's going on, if you want to call it progress, in Washington right now to make changes in these two wonderful programs is very, very frightening to seniors or anybody that is getting close to the age of being a senior. We did not send you to Washington to represent moneyed people. We sent you to Washington to represent the people in your district, like you will be hearing from today at this forum. We want you to go and listen. We want you to listen and hear. And beyond that, we want you to listen, hear, and then act, so that you are acting on behalf of your constituents in northern Wisconsin. We do not want you to be a rubber stamp for a political party. Thank you.
Congressman Duffy, my name is Dale Hansen. I'm from Barron. We often hear that 97% of scientists are in agreement that climate change is a serious problem. That's actually not quite true. It's more like 99%, and I'm one of the 99%. Congressman Duffy, climate change is real. It is real, and it is being caused by human activity. You need to start listening to the scientists and listening to those who really know the science behind climate change and taking it seriously to move the federal government toward the same place that most Americans are, and that is very, very concerned. Think about your children and everyone's children and grandchildren. Predictions are in 4 or 5 decades, the consequences of climate change will be unspeakable. Thank you.
Congressman Duffy. My name is Dee Taylor from Rice Lake, Wisconsin. I have several concerns. One concern is I studied this plan, tried to very hard. I could see nothing in it that wouldn't return us to the gender-based premiums that were in existence before the Affordable Care Act. So I am concerned about gender equity. I'm concerned about mental health and addiction that won't be covered under this new plan. I'm concerned about people in the 50s and 60s who are going to have their premiums raised significantly. And all in all, I'm concerned that you are thinking only of the 1% rather than the people in your district. Think about the people in your district. We're the ones that you need to answer to, not the 1%.
Congressman Duffy, I am Heidi Nelson from St. Croix Falls, Wisconsin, and I just wanted to tell you that I have taken Mr. Ryan's advice and I have come up with my own retirement plan, and that plan is death. Thank you.
Representative Duffy, my name is Joe Pluff. I am a constituent of yours. I here to speak a little bit differently rather than an issue, many important issues being brought up by your constituents. My issue is, it appears that there is a huge lack of respect from our elected officials to our constituents. I understand. I know that it is very hard to stand in front of people that we do not agree with. And it's not easy to do. I understand that. I used to do it myself as an elected official, as a state representative in the state of Wisconsin. It's not a pleasant thing to do. But for our democracy to work, it's your job to be here. It's your job to listen to these people. And I'm seeing a trend that scares the hell out of me. We have a governor that runs around and goes to closed-door meetings by invitation only. He's only hearing from the people that he wants to hear from. Our vice president was in Janesville last week, along with the Speaker of the House, your colleague, Representative Paul Ryan, and along with U.S. Senator Ron Johnson. And again, they met in a closed room with invited people in their own little bubble. And then they went out and they did their speeches and walked away. You need to be a bigger man than that. You need to be here listening to these people. Representative Duffy, that's your job. That's your main job. Thank you.
Hi, Representative Duffy. I'm very sorry you are not here to address this crowd of your constituents. My name is Barb Wise. I'm from Chippewa County. My husband owns property in Hayward, Wisconsin. I'm very familiar with this whole territory. I want to focus on health care. The reason being that is truly a life and death issue. In your district alone, the largest number of people affected, 26,503 people, are the high subsidy people under the ACA that stand the highest risk of being dropped off of their health insurance policy. These are the people that are here today that are representing people, their neighbors, their friends, their relatives. I also want to speak to something another gentleman mentioned, and I want to make sure I get the quote right that you said, abortion providers like Planned Parenthood do little other than provide abortions. First of all, that is a complete misrepresentation of what Planned Parenthood does. Planned Parenthood is not like any other healthcare provider. well over 90%, as you know, is preventive care, screenings for STDs, other health care issues that have nothing to do with abortion. So wherever you are on the pro-life, pro-choice, whatever, it has little to do. In the state of Wisconsin alone, Planned Parenthood provides 60,000 people, mostly women, but also men and young people with their primary health care. In half of the counties in the state of Wisconsin where Planned Parenthood Wisconsin is, 50% of those individuals who receive care there receive Medicare. It's a little bit of a misnomer to say, and you know this well, that the inclusion in the American Health Care Act, Trump Care, Ryan Care, whatever you call it, would defund Planned Parenthood. There is no line item, budget item for Planned Parenthood anywhere. There is no blank check to Planned Parenthood from the federal government. Those two things you know very well. What I want to say about that is for the inclusion in the American Health Care Act says that people who receive services at Planned Parenthood, of which there are 60,000, as I mentioned, in the state of Wisconsin, are covered by Medicaid. If they are not reimbursed by Medicaid, they do not have services. For many people, this is their only access to health care. You need to know that this is life and death for people in the state of Wisconsin. Thank you.
What I'm going to do from now on so that Representative Duffy can see who it is that agrees with or has someone who is using the services that are needed, I'm going to ask a question, general questions like, would everyone here who has used or knows someone who's used Planned Parenthood, please raise your hands. Okay, and that's the kind of thing I'm going to ask after, did you see the number of people? About 9/10? Okay. Okay.
Hi, Mr. Duffy. My name is Kurt Zemke. I'm from Rice Lake, Wisconsin. I've got a lot of questions I've been asking you and I still like to have answers to. I guess they vary on a bunch of different subjects, but this one is on the new Healthcare Act. What will happen to the mentally and physically disabled under the new Healthcare Act? I hope you realize this includes thousands of American veterans. And I would like to talk about the immigration program and the ban in America. I would like you and other Republicans to stop destroying immigrant families and traumatizing immigrant children. I also would like you to introduce legislation on equal pay similar to what Iceland did recently. And I guess the last one I'll ask, will you voice opposition to the new immigration ban, knowing it still targets Muslims? Thank you.
For those of you who are not descended from immigrants, please raise your hand. Okay. Interesting question.
Congressman Duffy, I've written you on many occasions, left articles in the newspaper for you to get answers for, so this may be the only way that I can get answers from you. I had asked you about the treatment of Native Americans out in North Dakota, why come other congressmen have stepped up against it, but yet you have been quiet. I've asked about seniors, why do you continue turning your back on them? Why do you continue turning your back on veterans? Why do you continue turning your back and running? My question for you, Senator Duffy, or Congressman Duffy, excuse me, is when are you going to stop running, do what we elected you to do, and stand up for the people of Wisconsin? My name is Mark Struble, Star Prairie, Wisconsin.
With those of you who do stand with the Sioux of North Dakota, please raise your hands. Thank you.